Hello, good morning, dear friends. Today I am going to discuss about a new topic that is a splint. What is a splint? A splint is a rigid or flexible device that maintains in position a displaced or movable part, also used to keep in place and protect an injured part, to support healing and to prevent further damage. A splint is a rigid और फ्लेक्सिबल डिवाइस. यह एक ऐसा डिवाइस उपकरण है जिसका प्रयोग ऑर्थोपेडिक केस, अस्थि रोग विकृति ऑर्थोपेडिक केस में हम करते हैं. A splint that maintain or after use of a splint, it helps in maintains in position to maintain in position a displaced or movable part, also used to keep in place and protect an injured part or damaged part, to support healing and to prevent further damage. Management of a wide variety of musculoskeletal conditions requires the use of a cast or a splint. A splint are non-circumferential immobilizer that accommodate swelling. This quality makes a splint ideal for the management of a variety of acute musculoskeletal conditions in which swelling is anticipated, such as acute fractures or sprains, or for initial stabilization of reduced, displaced, or unstable fractures before orthopedic intervention. So these are the use of the splint. Cast are circumferential immobilizer. Cast are circumferential immobilizer because of this cast provide superior immobilization but are less forgiving, have higher complications rates, and are generally reserved for complex and or definitive fracture management. To maximize benefit while minimize complications, the use of cast and a splint is generally limited to the short term. Excessive immobilization from continuous use of a cast or a splint can lead to chronic pain, joint stiffness, muscle atrophy, or more severe complications. So these abnormality arises when improper fitting or before reducing the swelling we use permanent cast, then these complications arises. So we always careful about the stage of the injury or inflammation. All patients who are placed in a splint or cast, require careful monitoring to ensure proper recovery. Selection of a specific cast or a splint varies based on the area of the body being treated and on the acuity and stability of the injury. Indications and accurate application. Indication and accurate application techniques vary for each type of a splint and cast commonly encountered in a primary care setting. This article highlights the different types of a splint and cast that are used in various circumstances and how it is applied. area of injury, type of splint, type of cast. Hand finger, ulnar gutter, radial gutter, thumb spica finger. Cast, ulnar gutter, radial gutter, thumb spica. Forearm, wrist. Volar, dorsal, forearm, single, sugar tongue. Short arm, long arm. Elbow, forearm. Long arm, posterior, double, sugar tongue, long arm. Knee, posterior knee of the cell immobilizer, long leg. Tibia, fibula, posterior ankle, long leg. Ankle, posterior ankle. Stripe, bulky, Jones, height of walking boot. In type of cast, short leg. Foot, posterior ankle, with or without toe box, hard sole shoe, height of walking boot. Short leg with toe box for phalanx fracture. So this chart shows area of injury, type of splint, type of cast. This is the figure which shows use of cast and splints. Classification of a splint. Basically, a splint divided into 4 groups: wire splints, metal based, resin based, and other. Wire splint, SS wire and composite and fishing line, twist flex wire, orthodontic brackets and wire. Metal based, arch bar, wire ligature, titanium trauma splint. Resin based, fiberglass roving, bonding with a Calver fiberglass splint, composite splint, ribboned, power chain composite. Others, acrylic cap splint, emergency splint, GC, Fuji, Ortho, etc. So a splint basically divided into 4 groups: wire splint, metal based, resin based, and others. So we see in short a splint and cast, its use, types. Complications and management of cast and splint is depend upon the severity of the injury and part of injury, how time it requires immobilization decided by concerned orthopedic physician. It helps in proper recovery and management, including pain management that reduces the suffering in cases of injury related with the muscles or musculoskeletal injury. Thank you for watching. Like, subscribe.